All right. So, what does this really mean for India? Let's put that question to our panel of experts. Joining me on the show tonight, Dr. Anup Amarnath, head of the Scientific Board and Chairman, Geriatric Medicine, Manipal Hospitals, and member of the COVID-19 Critical Care Support Unit of the Government of Karnataka. Dr. Sameer Gupta, co-chair, Healthcare, PhD, Chamber of Commerce, and Director, Cardiac Cath Lab Metro Group of Hospitals, and Dr. Ravi Godse, internal medicine specialist who practices in the US but is currently here in India. Thank you, gentlemen, for joining me. Dr. Amarnath, if I could begin with you, let's first look at the big picture and break down this data for our viewers. Now, you know, the staggering jump in daily cases that we are talking about is happening around the globe. The US, for example, has been reporting 10 lakh or a million cases a day for the last few days. But looking at India, in just the last 9 days, we've seen a 600% jump in our daily fresh COVID cases, and this when the third wave has only just begun. So one thing is abundantly clear: Omicron is spreading at lightning speed. What does this mean for India, for our healthcare system? How geared up are we?
So, as you rightly pointed out, let's look at the big picture, and I can share some numbers of Karnataka with you, which give us a good idea of how fast this is spreading. As of today, we had the new number of new cases in the state were around 4,000 odd, of which 3,600 were in Bangalore, and the test positivity rate has been 3.3%. The same number yesterday was 2,000, and day before yesterday was around 1,000. So this is practically doubling of numbers every 24 hours. And of course, the genomic sequencing is taking time, so it's very difficult to pinpoint how many of these are Omicron and how many of these are Delta. But the doubling in 24 hours, that's a concern. Now, what it means for the healthcare system, of course, we're seeing a surge of admissions over the last 24 hours. We've had to open up new wards in the hospital. Initially, you're looking at a ratio of 1:5. So initially, we had prior to the wave, if you had one ward, now you have 5 wards open. So that's the kind of pressure on the healthcare system. The only redeeming factor so far, if I can say, is the case severity. The case severity has been less. Touch wood, the number of people requiring oxygen and ICU has been less. The signs and symptoms have been mild to moderate. So if at all anything, that's a redeeming factor. But the rate of increase, the rate of test positivity, the rate of hospitalizations, it is something which is of a concern, especially over the last 72 hours.
Absolutely. This is a matter of huge concern. You're quite right, Dr. Amarnath, in pointing out that cases seem to be doubling every 24 hours, and it's happening across the country. It's definitely happened here in the national capital, a 94% jump. You're saying it's happened in Karnataka. It's definitely happening in Mumbai and the rest of Maharashtra. Dr. Sameer Gupta, the Union Health Ministry in its press conference today, while giving out this data, talked about not only the more than 58,000 fresh COVID cases that India added to its overall tally on Tuesday, the 4th of January, globally, over 25 lakh or 2.5 million COVID cases were registered. And this is the highest number that has been registered in the world since the onset of the pandemic 2 years ago. The question really is, what does this really mean for us? The fact that Omicron is certainly spreading like wildfire. Most health experts seem to believe that a majority of cases that are being reported in India are Omicron cases. Do we not need to be concerned about what this could mean for our healthcare infrastructure, let's say 3 to 4 weeks from now? Because as I keep saying, this is probably just the beginning of the third wave. And we'll have to remember, let me also quickly point this out, that, 65% of those 25 lakh cases that I just mentioned have been reported from the UK, US, France, Italy, and Spain. But the trouble is, Dr. Gupta, that India is at least 3 weeks behind these countries.
Absolutely, Neha. First of all, I think thank you for having me on the show. And you raised a very important point, and this is something that we've been talking about on this show and on other channels also, that Yes, the data that's coming out internationally is that the Omicron is not as severe as the Delta variant, which really took India in the second wave, which really created a lot of havoc. But however, it is much more infectious, and that's what you're seeing, right? You're seeing a lot more infection. You're seeing a lot more number of people who are getting infected. Those people who are getting really sick, or those people who are requiring hospitalization, is a comparatively smaller percentage. So if you go back and you look at the data which came out of China and other parts of the world with the Delta variant and the original Wuhan strain, that was about 20% of the people will require hospitalization. In this case, the number is much smaller. I don't know what that number is, but that number is thought to be much smaller. Now, when you see a smaller percentage of people requiring hospitalization, but more people getting infected, a small percentage of a very large number is a very large number. So that means a lot that we will have a lot more hospitalizations. It'll be a small percentage of the total case burden, but we will have a lot more hospitalization than what we are seeing currently. I think today, as we stand in January 2022, we are much more prepared than what we were in April 2021, when the India got the second wave. I think we've all understood how to deal with it. We all have seen the problems. A lot more hospital beds have been created across the country. The oxygen requirement, like my other panelists also mentioned, is much smaller in these patients. So these are all some things which are kind of positive. Are we really prepared? How bad will we get hit? That is something that is, time is going to, the story will unfold with
Absolutely, absolutely. And memories of the second wave are still so fresh in everyone's minds. That was an absolute catastrophe, and nobody wants to see anything close to that ever again. It was a nightmare, and that is a gross understatement. And you've made a very important point, Dr. Gupta, and that is something that a lot of experts, including top WHO officials, are saying. They are saying we need to stop downplaying Omicron by calling it mild, because at the very least, we have to take into account its very, very high degree of transmissibility. And such high transmissibility inevitably means more hospitalizations. And let's not forget about the size of our population and the fact that we have a huge segment who are elderly, who are immunocompromised, who are vulnerable. Let's go across to Dr. Ravi Godse at this point. Dr. Godse, the United States of America, for example, has been, recording 1 million fresh COVID cases every day for the last few days. And at the very least, there are 100,000 hospitalizations there. Some of these may be incidental. But I want to, for the benefit of our viewers, quickly read out this one data out to you. This is BMC data, the civic agency in Mumbai, which is, of course, seeing this, a lot of Omicron cases. They have set aside 35,000 COVID beds. I must clarify, these are not oxygenated beds, these are not ventilator beds, these are general COVID beds. 35,000 of these 5,000 are already occupied. In the last 24 hours, over 1,200 people have been hospitalized in the city of Mumbai, and out of these, 80 are on oxygen support. The question I want to put to you is simply this, that if this is where we are in terms of our data and hospitalizations at pretty much the start of this wave, what can we expect when we get closer to the peak of this wave? That could be 3 weeks away, that could be 6 weeks away, I don't know, but we are definitely behind Western countries by at least 3 weeks, you would agree?
I won't. Yeah. I will start with several questions. First is, you said 1,200
We expect you to answer questions, not ask questions on the show. Sorry, it's my job to ask questions. You're the expert. You have to answer them.
Most of them are rhetorical. Go ahead. I'm sort of upset. You said 1,200 people are admitted in Mumbai, correct?
In the last 24 hours, yes.
And 80 are on oxygen.
As of now, yes.
My big question is, why are the other 1120 admitted to the hospital? What is the need to admit a patient who's not requiring to the hospital.
Maybe they have comorbidities. We don't know that, doctor. We don't know that yet.
I think they are admitting them for isolation. I think we have to stop this isolation, test, stress, isolation, idiocy once and for all. The world needs to learn. If US has 1 million cases, where are they going to contact trace 1 million people's contact? That will be 20 million. That's almost like 10% of our population. The whole nation will go into isolation and quarantine, and the economy will go in tank. That will happen in couple days. That is one thing. Second thing is, why do we keep wondering? We don't know how much of it is Omicron and how much of it is Delta.
No, we are assuming a majority of these cases are Omicron.
Yeah, and the reason is, prior to all this happening, the Delta cases had plateaued at 8,000 like a pack of buffaloes, and they were not moving either here or there. So Delta was not moving anywhere till Omicron came. So Delta is not going to suddenly spurt. Delta is actually going to be fighting with Omicron, and Omicron is getting better of it. That is second point. Third is, this excited and reverential voice that we use to report cases, that, oh, there are 60,000 cases, 80,000, 1 million cases. Why do we not use the same tone to report what's going on in South Africa and UK?
No, we've been reporting it for days now, I assure you. We have.
Okay, in looking at UK, the UK today said that the wave, they think, at least in age group 19 to 50, it has plateaued and it will start to decline. I think, let's not get into like what is reported, and you're right, it's your job to ask questions. I'm here as an expert. I think most of these cases are mild. If you look at the hospitalizations, obviously by sheer number they will go up. We have to focus all our energies on making this trying to do something for this hospitalized patient, because I don't think we should spend too much time in genome sequencing. Why would you do that? Are you changing the RT-PCR? Are you changing the vaccine? Are you changing the booster? Are you changing remdesivir? Are you changing oxygen, steroid? Nothing. So if you're not changing the finding, the treatment, and the further course of the virus, then how does it benefit you to know whether this is Delta or whether this is
I take your point. Yes.
And the only way to this would benefit is sotrovimab, the monoclonal antibody, works against Delta and Omicron.
Yeah.
But the current monoclonal antibodies that we have, they do not work against Omicron. US is going to stop that. I had advised some patients, if they are really high risk, just to take the monoclonal. They might be wasting a dose. If it is Omicron, it will finish it. If it is Delta, it will finish it. If it is Omicron, they probably don't need it. But my point is, this, first of all, if it is doubling so quickly, obviously we cannot contain the spread now. It's beyond.
I take your point, Dr. Godse, but let me get the opinion of the other doctors on what you've just said. I take your point that if you're assuming that a majority of these cases are Omicron, then you believe, not my opinion, you believe, why are we wasting our resources on genome sequencing? However, the other argument that you're making is somewhat more controversial. I want to put that question to Dr. Amarnath. In all fairness, Dr. Amarnath, Dr. Ravi Godse is not the first doctor suggesting this. There are other epidemiologists in this country who have actually said in recent days, and they've also got flack for it, if I may say, online, for suggesting, forget about testing, tracing and isolation. Those are old rules of the game. They're not going to work anymore. We are now in the Omicron era. Is that something you would agree with?
No, I think, we need to look at what science says. And, there are two specific reasons as of today where you would need a classification of which is Omicron and which is Delta, for two reasons. One, of course, the treatment modalities, as the other doctor rightly said. We have preliminary data which clearly says the combination, the existing combination of antibody cocktail that we're using, which is not effective against the Omicron strain, and there could be certain antibody cocktails which could be effective on the Omicron strain. That is number one in terms of treatment. Number two, in terms of the duration of isolation, if you see the Karnataka government guidelines, the number of days that an Omicron suspect or Omicron positive person needs to stay in isolation, and the criteria to come out of isolation of having to have a negative RT-PCR post-hospitalization. So these 2-3 things have a huge impact on my clinical management. So I don't want to blindly treat somebody without knowing what the strain is. But having said that, we have to go on the ground, what is the actual feasibility of how we treat these patients. So number one, it would be very crucial for us to identify the strain, both in terms
So
of
you
the
are significantly disagreeing with Dr. Godse on all those issues. You believe testing and tracing are important, isolation is important, so is genome sequencing, because we may still have a sizable number of Delta infections. That's interesting. So you obviously differ on that
Yes.
issue. Very quickly.
Because I'll give you on the
Okay.
ground example that we have still Delta strains coming in
Okay.
with high involvement of the lungs requiring high dose steroids. So yes, Delta is still
It's still
prevalent.
prevalent. It's not gone away. Interesting. You two obviously differ on that issue. Very quickly, Dr. Amarnath, before I take this to the others, do you believe self-test home kits are sufficient to detect Omicron? Is that something you would encourage people to use? You know, because people are very confused. You have a runny nose or a headache. You don't know, especially if you're in Delhi, where we're nearing the peak of winter. You don't know if it's the common cold or if it could be Omicron/COVID.
No, one thing which will have to be very clear is that the home testing kit will not detect Omicron. It will just tell us whether
No.
it's
I'm not
COVID
saying we will
positive.
know that it's Omicron, but it is likely to tell you that you're infected with COVID or not.
Absolutely, yes. So it's a good screening method, and it is something which should flag up, and then you need to reach out to the clinicians and the hospitals to take things forward. So that's a good screening methodology
Yes.
that needs to be used.
Yes, I think we more and more of us need to do that, given the rate at which these cases are spreading. Of course, whether it's Omicron or not is something that only genome sequencing can tell you, but at least an antigen test at home can tell you whether you're infected with COVID or not. Dr. Sameer Gupta, your views on what we are discussing here. Do you believe we are at a stage where testing, tracing and isolation don't make sense anymore? Or are those rules that we need to still stick to? And talking about isolation, just for the benefit of our viewers, today the Health Ministry said that patients under home isolation can end their isolation after 7 days of testing positive and no fever for 3 successive days, and then there is no need for a retest. Which of the two approaches do you agree with?
I think I agree with the test isolate approach, because it's kind of important for us to know, for example, now we know that the Omicron variant is very infectious. Yes, you are living in Delhi, it's polluted, today there was some rainfall, and you may get, the cold, as you call it. You may just think it's a cold, and you may go out and you may interact with your family members, you may interact with children, and you may pass on the infection to them if it's Omicron. Right? You may think it's a cold, but it may be the Omicron variant, which you may have picked up wherever, right, from your workplace or from your public transportation, from the market, or wherever. So it's important for us to identify what it is. And regarding the home isolation kit, I think the home isolation testing is a very important means right now. There are many patients whom we are seeing right now. We're getting a lot of calls that, I really don't want to get into the RT-PCR route. There's a big headache. People will come. I'll get trapped. So they're using home isolation. They're using the home testing. And then they're calling me up and saying, you know what, I tested positive on the home kit. And you recommend, so there's a sizable percentage of people who are doing that, and they are not coming in the numbers. So the numbers are definitely underestimated that we are seeing. But these people are at least getting some tests done, and they're not completely boycotting, or they're not.
Just for the understanding of our viewers, would it be correct to say, Dr. Gupta, that if you test positive in an antigen test, then you're definitely positive? But if that throws up a negative result and you still believe you have symptoms, then it is best to go in for an RT-PCR test?
100%. So the rapid antigen test we do at home has a low sensitivity but a high specificity. Sensitivity means that if the chances of it picking up the strain or picking up the virus is not 100%. It's about 30, 40, 50%. Depending upon how you do it and what test kit you're using. So the sensitivity is low, but if it is positive, then it is positive. There's nothing like false positive. If it is positive, it is positive. However, if you're
negative, but there's no such thing as a false positive. I think that's important for people to understand. I think that's good advice. Final question to you, Dr. Godse. Very, very simple question that a lot of people are grappling with. I have a headache or a runny nose. I'm in Delhi, like I said, it's winter here. I don't know what it is. It could be the cold, it could be COVID. What am I supposed to do?
If you are my patient, I will tell you not to test.
And not to do anything? What if I'm infected and exposing other people?
Let me finish. If you are young and healthy, if you are positive, if you do antigen test, if it is negative, you're going to do RT-PCR. You're going to choke the whole world by doing these millions of RT-PCR. If your result comes positive, what are you going to do? Nothing. There is no treatment. What is the treatment? Now you can give remdesivir early. There's a New England Journal study. But that is only in high-risk people. We are only going to treat high-risk people. So if you're not high-risk, why do you need to know? That's first question. My second thing is, Paxlovid is a medication that kills both Omicron and Delta. Sotrovimab kills both Omicron and Delta. Boosters help significantly against Omicron.
Okay.
And mix and match boosters help significantly. These four things are
in
not
fact,
done
I'm
by
glad you're
anyone.
talking about mix and match boosters, because Dr. Godse, just today the Union Health Ministry said no mix and match vaccines. You will get a booster dose of the same vaccine that you've got in the past. India is very clear on that now. No mix and match vaccines.
The whole world is doing mix and match. Heterologous prime boost works the best.
Yes.
If you have Virat Kohli and Tendulkar in your team, you don't need a Rohit Sharma. Get Ashwin. You just broaden your coverage. The whole world is doing that. US is doing that. UK, Europe, there are multiple studies.
Yes.
It works the best. Maybe in Covaxin, they are okay because it's a bigger vaccine. It's already a multifaceted vaccine. But with Covishield, definitely. Covishield is a vector vaccine.
Okay.
So the body makes antibodies against vector too. So the third dose is not going to be as effective.
I agree with you, Dr. Godse. I wish the health ministry would listen to you and me. But at the moment, they certainly have made up their mind. No mix and match vaccines. But on that note, gentlemen, thank you so much for joining me on the show and for answering so many important questions that people have about COVID and Omicron. Thank you very much to the guests, and thanks to the viewers for joining me. Good night.